Hi, Dr. McCarthy here, and I want to welcome you to Neuropathy Success Secret number 5. We've been talking a little bit about autoimmunity and how it can play a role in the neuropathy that you're dealing with, the burning, the numbness, the tingling, the pain, the relentless pain that you're dealing with that the medications can't help you with. If you've got an autoimmune condition, part of that is figuring out what are the triggers. And this is my job. This is what we do in our office on a daily basis. There's many different things that can trigger this autoimmune response, and we're going to talk about some of those today. One of the major things that we see are chemicals. We live in a world nowadays that's just, we're bathed in these chemicals. We're breathing them in, we're touching them, we're walking on them. Benzene is a common one, formaldehyde, pesticides are just all over the place. There's a big company that you spray to kill your weeds. This is a disaster, and we're starting now to see what the long-term ramifications of that are. But if you've got neuropathy, I would tell you to stop killing your weeds that way. Pick them instead, or get your kids out there to help you. BPA, big one. This is in all the plastic bottles. We are all drinking water out of plastic bottles. Well, one of the things that we found is that these bottles, cheaply made bottles, contain a chemical called bisphenol A. And this is not only a carcinogen, but it also irritates your immune system. So if you're buying your water bottles from the grocery store, you better make sure you're buying the glass bottles. We go over that with all of our patients. Iodine. This is a common supplement that people take, especially if you have maybe an underactive thyroid. You've read it somewhere that iodine would be really good for you. It's great for your thyroid function, and many people will take this. The problem is iodine can create an autoimmune response in many people. So you're taking something that you think is supposed to help you, and it could be making you worse, making your thyroid worse, making your neuropathy worse. You got to know what you're putting in your body. Foods, this one is huge, and there's just way too much to cover in this short video, but there are dozens of different foods that are the main trigger for autoimmune conditions. So you're eating these foods that you think are healthy for you, and it's making you worse. You've got to get the proper testing done. Cyrex is the lab that we use. And then lastly, infections. And many times people say, well, I went to my doctor and they said my blood work was all normal. However, infections are pretty, these bugs are pretty creative, and what they do is they bury themselves inside your body and they cover themselves up with what's called a biofilm so that they can't be detected. And it's very hard to see an infection like this on your blood work. You've got to have all of these things put together. You've got to have them all evaluated. If you are still suffering with the burning, the numbness, the tingling, the pain, you owe it to yourself to call our office now and find out if you've got any of these autoimmune triggers. Thank you.